Welcome back to Learning Anatomy with Dr. Bakare. In this lecture, we'll be looking at the inferior gluteal artery. I've put up a lecture on the superior gluteal artery. If you've not checked up that lecture, please kindly go and do so. The inferior gluteal artery is one of the terminal branches from the anterior trunk of the internal iliac artery. In this lecture, we'll be looking at the part of this artery, and also the different branches that it gives. The inferior gluteal artery, as we've previously highlighted, it is one of the terminal branches from the anterior trunk of the internal iliac artery. Let's try and use this image by the side to describe how the inferior gluteal artery emerges. This structure that is highlighted here in black is the abdominal aorta. And we know that the abdominal aorta at its inferior end, which tallies with the fourth lumbar vertebra, is where it is seen to bifurcate into two. And at this point, you see the abdominal aorta bifurcating into the left common iliac artery and also the right common iliac artery. So you have two common iliac arteries on both sides, which of course we also finally divide into the internal iliac artery that is highlighted here at this point, and also the external iliac artery. The internal iliac artery, just as the name implies, internal, it means it is directed towards the pelvic cavity, while the external iliac artery is directed externally downward to supply the lower limb. This internal iliac artery is further subdivided into two trunks. So within the pelvic cavity, you have the internal iliac artery dividing into the anterior trunk that is highlighted here in red, and also posterior trunk behind that is highlighted here in blue. The anterior and the posterior trunk is what give branches of the internal iliac artery. The anterior trunk is seen to give off a number of branches before finally terminating into the internal pudendal artery that is highlighted here in pink, and also the inferior gluteal artery that is highlighted here in blue. So you see that the anterior trunk of the internal iliac artery will give off a number of branches, where it will then be finally seen to terminate into the internal pudendal artery and also the inferior gluteal artery. In this lecture, we'll be focusing on the inferior gluteal artery. So this inferior gluteal artery is seen to supply mainly muscles that are located around the gluteal region. So looking at the course within the pelvic cavity, we say that this artery emerges as one of the terminal branches from the anterior trunk of the internal iliac artery. After its emergence, it is seen to pass between the first and the second sacral spinal roots. If you look at this image by the side, the structure that is highlighted in dotted red are the spinal roots of the sacral nerves. So we have the S1, the S2, the S3, and also the S4. So you see that after the emergence of the inferior gluteal artery as one of the terminal branches from the anterior trunk of the internal iliac artery, you see that it is directed or seen to run between the first and the second sacral spinal nerves. And this is what is projected here in this image. If you look at how it runs, you see that after passing through between these spinal roots, you see that it is directed inferiorly towards the piriformis. Within the pelvic cavity, it is seen to give off branches to supply the pelvic floor. We know that the pelvic floor is made up of a number of muscles, and it is seen to be lining the inferior limit of the true pelvis where this emergence will occur. So you see that the inferior gluteal artery is seen to give off branches to supply muscles of the pelvic floor. So it is specifically seen to give off branches to supply the ischio-coccygeus muscle, which of course is one of the pelvic floor muscles, and also the iliococcygeus muscle, which of course is also one of the levator ani muscle that form the structural component of the pelvic floor. So all in all, you see that these muscles are seen to contribute to the formation of the pelvic floor. And these are the muscles that the inferior gluteal artery will give off branches to supply within the pelvic cavity. After giving off these branches, it then proceeds in its course, and the direction would be to exit the pelvic cavity. So let's go through the next slide to see how the inferior gluteal artery would exit the pelvic cavity. The inferior gluteal artery is seen to exit the pelvic cavity through the greater sciatic foramen, and it is specifically seen to be directed towards the infrapiriform foramen. If you try to use this image by the side here, this is where we have the inferior gluteal artery. You see that this inferior gluteal artery, after it emerges from the anterior trunk of the internal iliac artery, it is directed towards the inferior border of the piriformis. And this is what is highlighted here in this image. And this is where we have the piriformis here in green. So if you look at the part that the inferior gluteal artery runs after it emerges, you see that it is directed towards the inferior border of the piriformis. And specifically, this region is referred to as the infrapiriform foramen. So let's try and use this image by the side to describe how the infrapiriform foramen is formed. So if you look at this image by the side, this structure that is highlighted here in dotted black is the greater sciatic notch. This greater sciatic notch, we already described it in our previous videos, that it is an indentation that is created on the ilium. So you see an indentation here created on the ilium, and this is marked here in dotted black. This indentation is what is transformed into the greater sciatic foramen. And this is where you see a notch being transformed into a foramen. And this transformation is done by a ligament that is referred to as a sacrospinous ligament. So you see that we have the sacrospinous ligament here highlighted at this point. The sacrospinous ligament, you see it running from the spine of the ischium here and is inserted on the other side on the sacrum. And as it runs to and fro these two regions, you see it transforming this notch into a foramen. So you see the creation of a foramen around this posterior region. And this is what is highlighted here in yellow. Upon this creation, you now have the establishment of a foramen. And this foramen is so created to allow for the passage of structures. So if you drive deep into the greater sciatic foramen that is highlighted here in yellow, you see the piriformis here arrowed. This piriformis is seen to run through the greater sciatic foramen. If you look deep through the greater sciatic foramen that's carved out here in yellow, you see that you have the piriformis passing through this foramen. And if you go back to how the fibers of this muscle originate, you see that they originate from the anterolateral surface of the sacrum. This is where we have the sacrum. So the fibers of the piriformis will emerge from the anterolateral surface of the sacrum and will be directed through the greater sciatic foramen. And through this, you see that the fibers of this muscle will exit the pelvic cavity. And this is where they will be directed towards the gluteal region and finally running laterally to be inserted on the greater truncator of the femur. This is where we have the greater truncator here at this lateral edge. And this is where the fibers of the piriformis will finally be inserted upon. So if we drive back into the greater sciatic foramen, you see that there's a pattern by which the fibers of the piriformis run through this greater sciatic foramen. And this is where to further be subdividing the greater sciatic foramen into two subforamina. So superiorly above here, that is harrowed here in purple, you have the suprapiriform foramen. This suprapiriform foramen is a foramen that is located or situated superior to the piriformis. And this is why it is so named the suprapiriform foramen. This foramen is created to allow for the passage of some structures. Also inferiorly to the piriformis, you have the infrapiriform foramen. And this is called the infrapiriform foramen because it is a foramen that is created inferiorly to the piriformis. And this is what you have here harrowed in red. This infrapiriform foramen is what allows for the passage of the inferior gluteal artery. If you go back to our lecture on the superior gluteal artery, you see that we highlighted in that lecture that the superior gluteal artery runs through the suprapiriform foramen. And this is where they provide allowance for the passage of structures. So you see how these two arteries run within the greater sciatic foramen. So we can say that the infrapiriform foramen is a subset of the greater sciatic foramen. And this is where we have the inferior gluteal artery running through. So this is how they are finally seen to exit the pelvic cavity. And at this point, the inferior gluteal artery is then seen within the gluteal region. It's also important for us to add that this vessel is related to the internal pudendal artery. The internal pudendal artery is the second terminal branch of the anterior trunk of the internal iliac artery. Remember, we highlighted this in our previous slide, that we have two terminal branches. We have the internal pudendal artery and we have the inferior gluteal artery. They also run in close relation to each other. As the internal pudendal artery is seen to also pass through the infrapiriform foramen. If you go back to this image by the side, this is where we have the inferior gluteal artery. So you have the internal pudendal artery crossing anterior to this vessel. So you see that the inferior gluteal artery is seen to run behind the internal pudendal artery. And this is the kind of relationship that is seen between these two vessels, even though the two vessels are seen to pass below the piriformis. This region is specifically referred to as the infrapiriform foramen. So it's good for us to also highlight this. So now in the gluteal region, remember we described in our previous slide how the inferior gluteal artery exits the pelvic cavity. And upon its exit, it is then seen to be positioned within the gluteal region. In the gluteal region, it is seen to run deep to the gluteus maximus. If you look at the orientation of the gluteus muscle around the gluteal region, we say that we have the gluteus minimus as the deepest layer of muscle that is located around the superficial gluteal space. We've also tried to describe this in our lecture on the gluteal region. So we have the gluteus minimus that is highlighted here in red. This gluteus minimus is overlined or covered by the gluteus medius. And this is what we have here highlighted in green. This gluteus medius is then also overlined by the gluteus maximus. And this is how these muscles are layered within the superficial gluteal region. Also in our previous slide, we highlighted the greater sciatic foramen. This is what is highlighted here in dotted red. This greater sciatic foramen is what creates the passageway for the inferior gluteal artery. Also remember that this greater sciatic foramen also allows for the passage of the piriformis. So we have the piriformis here highlighted in black, and it is this piriformis that subdivides the greater sciatic foramen into two foramina. So we have a foramen created above the piriformis and also another created below the piriformis. So those still within the greater sciatic foramen. So the foramen that is created inferior to the piriformis, which is referred to as the infrapiriform foramen, that is seen to allow for the exit of the inferior gluteal artery. And this is what is highlighted here in pink. So you have the inferior gluteal artery at this point, but it is located deep to the gluteus maximus. This is where we have the gluteus maximus here highlighted in purple. You see that the gluteus maximus is seen to be overlying on the gluteus medius that is highlighted here in green. But I try to use this other side of the image so as to keep the inferior gluteal artery exposed so that we can see the branches that will finally emerge from it. So if you try to place this gluteus maximus on top of this gluteus medius, you would see that the inferior gluteal artery will be running deep to the gluteus maximus, and that is how it runs around the gluteal region. So you have a number of branches also emerging. The first branch that we have are muscular branches. We have a number of branches which are highlighted here in blue, and these are the muscular branches. These muscular branches are seen to provide supply for muscles around this region. We'll be looking in details into the different muscles that the inferior gluteal artery will be providing supplies for. Another branch that you see is the artery to the sciatic nerve. This is where we have the sciatic nerve here highlighted in yellow. We know that the sciatic nerve is one of the branches from the sacral plexus, and it is also seen to pass inferior to the piriformis. It also gives a branch to supply the sciatic nerve, and this is what is highlighted also here in yellow. So you have a branch also emerging from the inferior gluteal artery, also supplying the sciatic nerve at this region. Then you have anastomotic branches. These anastomotic branches are seen to create anastomosis around the truncator of the femur. And this is what is highlighted here in white. So you see a number of branches also contributing to the formation of anastomosis around the truncator of the femur. And this is what is highlighted here at this point. Then we also have cutaneous branches. These cutaneous branches are seen to emerge, and they are seen to provide cutaneous innervation to the skin around the gluteal region, so the upper region of the thigh. So these are the branches that would emerge from the inferior gluteal artery. And we've tried to highlight the different branches and also the structures that they would be providing supplies for. So it gives muscular branches to a number of muscles around the gluteal region. And it is good that we're able to highlight the specific muscles that it provides supply for. So it's seen to give supply for the gluteus maximus. And this is what is saying here to be highlighted at this point. We know that the gluteus maximus is the most superficially placed muscle around the superficial gluteal region. and it's seen to be overlying on the gluteus medius and the gluteus minimus. So you see that branches from the inferior gluteal artery will also give a contributory supply to the gluteus maximus. We know that the gluteus maximus also receive branches from the superior gluteal artery. So the inferior gluteal artery also gives a contributory branch to help also supply this muscle. Then the second muscle that we have is the piriformis. You also see the inferior gluteal artery giving supply to the piriformis, and this is what is highlighted here in blue. This is where we have the piriformis here around this region, and it is also seen to provide supply for this muscle. We know that the piriformis muscle also receives branches from the superior gluteal artery. So the inferior gluteal artery is also seen to give a contributory branch to this muscle. Then we have the obliterator internus, and this is where we have the branch from the obliterator internus here. You see that this branch is seen to also give supply to the obliterator internus muscle. The obliterator internus muscle is also seen to receive branches from the superior gluteal artery and also the obliterator artery. So the inferior gluteal artery is also seen to contribute to this supply. Then the next muscle that we have are the superior and the inferior gemini muscle. These muscles are also seen to receive branches from the inferior gluteal artery, and this is what is highlighted here in green. Then the final supply that we have from the inferior gluteal artery is the supply to the quadratus femoris muscle, and this is what is highlighted here at this inferior end in purple. So we have branches emerging, also supplying the quadratus femoris at this lower edge. So if you drive deep in establishing the different muscles that the inferior gluteal artery supplies, you see that they are basically muscles that are located in the lower gluteal region, even though it's seen to give contributory supply to muscles at the upper gluteal region. So it's good that we are able to highlight these muscles. It's also seen to give a branch to the sciatic nerve, as we have highlighted in our previous slide. Then see it giving a contributory branch to anastomosis that is formed around the truncator. And this is to supply further vasculature around this area. Then finally, it's also seen to give cutaneous branches to muscles in the gluteal region and also the upper region of the thigh. So those are the branches that emerge from the inferior gluteal artery. And it's good that we're able to highlight it, specifically highlighting the muscles that it gives supplies to. So thanks for watching this video. Let's continue to stay glued to this channel.